The coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu, says federal government cannot bear the cost of COVID-19 testing for incoming passengers. Speaking at the PTF briefing in Abuja, Aliyu said the number of passengers coming into the country was above 5,000 and would be a huge burden for governments to take up the financial burden of the COVID-19 test.
Currently, about 5,000 air travelers come in and out of Nigeria. And the PTF wants to ensure that we do not lose the gains made in the response. It is therefore critical that passengers get tested and follow protocols correctly. When fully open, the number of passengers going through the country is not small. At the moment, our daily testing numbers is about 2,500 a day. If we add the passenger numbers coming, potentially we are tripling the number of tests we do every day. And that's why we have to use the private sector to get this leverage, while at the same time working to bring down the cost for passengers. Therefore, it will be costly and unrealistic for the federal government to bear the cost of a test for each passenger coming into Nigeria. This will not only be unsustainable, but will also redirect precious resources away from the public health response. The PTF has agreed, and in line with the draft West Africa Health Organization guidelines, to extend the period of validity for the COVID PCR test that passengers need to board when coming into Nigeria from 96 hours to 120 hours. Nevertheless, we still continue to strongly recommend that tests be done as close as possible to the time of departure, because this is what will reflect the person's true infectious status, not only in the plane, but also at the point of arrival in Nigeria. While we continue to have issues with payment, we will not insist on evidence of payment before boarding, but we will be releasing a strong recommendation to airlines that preferably people come on board with a QR code. It will be a strong recommendation, but will not preclude boarding. We have identified 13 countries that had significant discrepant COVID-19 test results, of which 9 had a significant percentage that were discrepant, that we couldn't explain by just the incubation period. We are working closely with these countries to rectify the matter.
For his part, the Director General of the Nigeria Civil Aviation Agency, NCCA, Captain Musa Nuhu, had this to say.
Basically, the issues we've had over the last 1 week for the international passengers coming in had to do with the online platform where you fill in all the information, upload your PCR negative test, and pay for the second test in Nigeria. I'm glad to report most of these problems, technical issues have been resolved. So